Hi, my name's Kelly. I work for Registration RGH. My job today is to report out on the extra duties that Registration has taken over. One being stamping data sheet, which helps assist Triage to better take away some of their time. Also, we've got access to SCM board, which allows us to flow the visitors through to the patient. And then we took in parking, which now they don't have to look where they need to park. We will have that at the registration desk so we can remind them to park, and we won't give them any unnecessary parking tickets.
My name is Corrine Jabes. I'm a gynecologist, and I was a participant in this RPIW. We trialed our new process using two providers, a registered nurse as a triage nurse and a registration clerk. We had 3 computer systems set up, knowing at times that we will have up to 4 providers in this setting. One of our goals of the new process was reduction in distraction and interruptions to the triage nurse. The new process allowed leveling of the workload related to traffic of the family coming into the emergency room, going through access doors, as well as preparation of the chart with some stamping. But even more so, the physical proximity facilitated load leveling by allowing easy access for the registration staff to the triage nurse if there are questions that arose related to the need for urgent triage, or questions related to alerts on the Sunrise Clinical Management Board that signaled restricted access to certain patients. Our stick tally of our triage RN interruptions shows that we were successful. The pre-RPIW rate of interruptions was 1.9 interruptions per patient triaged and 44 interruptions per hour. This was reduced to 1.13 interruptions per patient and 6 interruptions per hour. Our percent load chart shows us that both of these individuals were working below their TAC time of 7 minutes and 44 seconds. By this change in process, we have increased the cycle time of the registration clerk from 2 minutes and 54 seconds up to 3 minutes and 15 seconds. The triage nurse time did go down from 5 minutes to 4 minutes and 30 seconds for triage of the patient. Now, both of them do have other duties that are more colorful on our graph, but this small shift in workload at the level of the registration triage nurse had a large impact on patient flow. Now, it is important to note that the physical layout of the current area does not allow this new process to continue long-term. We trialed it in 2 different locations, neither of which were ideal, and there is reconstruction that's required. We do need to remove the glassed-in high triage desk that is currently in place and replace it with dual-function workstations for both the registration and the triage nurse, and this requires their computer terminals, their printing devices, and their vital sign equipment.
Hi, I'm Brenda. I'm RN representing the Pasqua Emergency Department this week on our RPIW team. This week we got a chance to do some 5S'ing. One of the areas that we looked at was the EMS radio patch corner. This is what the area looked like prior to 5S'ing, with an evaluation score of 1 out of 5. We were able to remove 36 items that were deemed unnecessary to this area. This is what the area looked like post 5S, with an evaluation score of 4 out of 5. 5S is an important part of the RPIW, as it makes us realize that the just-in-time aspect of what this is all about. The area is 5S'd, and now is what the nurse needs at the right time, in the right place, and in the right amount.
Hi. Sorry. I'm Vicky, registration from the PASCA. During this week, we had Hygiene also brought up. We had Tricia from Infection Control come and show us standard protocol for using the isogel along with when it should be done. Putting this into effect will increase the safety of patients and staff by decreasing the transfer of germs. We developed standard work and multi-level skill training forms to assist in this. I also worked on forms. We are working on combining the present ER database with the master signature sheet, which would result in one sheet having the ER database on one side and the signature sheet on the other. This would cut down on the number of sheets needing to be stamped at registration triage desk, paper used, storage space, and compliance of use. Doing this would save roughly 55,000 pages per year.
I'm Brad, and I'm with the KPO, and I was the sub-team lead on this project. One of the idea sheets that came forward was regarding our cleanliness of equipment, and in particular, our wheelchairs. So we did an environmental scan, and really on the internet we found a really cool idea, which was basically to use a sani wipe much the same way as you would use it in a grocery store. So we developed some standard work around that. We did actually do a culture of we ran around, did swabbed, and we did a culture of what we did, and we grew it for a day, and this is one of the examples of what we found on our wheelchairs. So we developed some standard work around how to clean a wheelchair with a sani wipe. We also developed a visual cueing system for cleaning of wheelchairs. And then we developed a multi-skill task sheet, which I think you've seen previously in this presentation. Then I just want to talk about the newspaper items. I'm not going to touch on every one. I'll just touch on a couple of highlights. What we have left to do is work around the education. So we've got education around how parking should be completed, hand hygiene, how the wheelchairs need to be cleaned, and also about information for patients and who will do that and how it will all take place. We have a number of interruptions. One of them really deals with our fast track system, and so we're looking at trying to get a second pager in the triage area. Also, staff tend to use the emergency room as a thoroughfare into the rest of the hospital, and so we're trying to reduce that. So we're working on the compliance of all staff to reduce that traffic. As you saw, we've tried to combine emergency registration and triage together, and in doing so there are a couple of ergonomic factors with the way the desk is set up, and those have to be dealt with. And then some of the forms that we were able to redesign need to be submitted to the forms committee and to get approval for those forms. Talking about the target progress sheet, okay, we have patient walking. We reduced that by 38%, registration walking by 50%, patient lead time by 10%, interruptions for triage down to 43%, and the 5S, of course, we went from 1 to 4 in that phone area, which resulted in a 300% increase in our 5S.
So you might have guessed by now we had some of moments, because we put up, ripped down, moved staff 4 times, 2 different places. Some said even that it was a gong show. But our patients kind of liked it, and our staff actually believed in the process. So you've heard of some of what was accomplished with the real focus on reducing the movement and the confusion of our patients and our families, and it really was a big change to bring staff together from different areas that had never worked side by side and do something completely different. We also told you a story of just do it small things that really add up. Easier things in terms of how loved ones can find their family members, not get a parking ticket, and really look at safety from a real basic way in terms of hand hygiene, wheelchairs, so that we don't share the germs. We learned about standard work, whether that was 5S'ing or taking out forms we never needed and stopping wasting paper. We couldn't have done it without a whole group of people. And it took the understanding of our patients and families. It took the willingness of our staff to try things, honestly give us feedback, be creative. The Go team and the support that came in helping us actually improvise in real time and try and see new things was amazing. Our sponsors, Glenn and Francis, thank you. Our process owners, Peggy and Lana, thank you so much. And I have to say a personal thanks to the team. They put up with me as a novice team leader. They helped me learn. They covered all the mistakes. To Kathy, she was a fabulous mentor and coach, and we learned a lot. So thank you very much.